High blood pressure, or hypertension, is a common and potentially serious medical condition that affects millions of people worldwide. While genetics and other factors play a role, diet plays a significant part in managing or exacerbating high blood pressure. Certain foods are particularly detrimental for individuals with hypertension. In this video, we'll delve into the 10 worst foods for high blood pressure and explain why they should be limited or avoided. Sodium-rich foods. High sodium intake is a major contributor to hypertension. Sodium causes your body to retain water, increasing blood volume and subsequently raising blood pressure. Processed and fast foods are often loaded with sodium, so it's essential to read labels and reduce consumption of items like canned soups, processed meats, and salty snacks. Processed meats. Bacon, sausages, hot dogs, and other processed meats are not only high in sodium but also contain unhealthy saturated fats. These fats can contribute to the buildup of plaque in your arteries, making your heart work harder to pump blood. Sugar-sweetened beverages. Sugary drinks, including soda, fruit juices, and energy drinks, are high in added sugars, which have been linked to hypertension. Consuming excessive sugars can lead to weight gain, insulin resistance, and increased blood pressure. Trans fats. Trans fats are found in partially hydrogenated oils often used in fried and processed foods. They raise bad cholesterol levels and increase inflammation, both of which can negatively impact blood pressure and cardiovascular health. Alcohol. While moderate alcohol consumption may have some cardiovascular benefits, excessive drinking can lead to hypertension. The guidelines for moderate drinking suggest up to 1 drink per day for women and up to 2 drinks per day for men. Going beyond these limits can lead to elevated blood pressure. Caffeine. Caffeine, found in coffee, tea, and some soft drinks, can temporarily raise blood pressure. For some individuals, it may have a more pronounced effect. If you're sensitive to caffeine, it's important to limit your intake. High processed and refined carbohydrates. Refined carbohydrates, like white bread and sugary cereals, can cause blood sugar spikes, leading to insulin resistance and higher blood pressure. Opt for whole grains, which are high in fiber and can help regulate blood sugar levels. Canned and packaged soups. Many packaged soups contain high levels of sodium, often well above the daily recommended limit. Even seemingly healthy options can be problematic, so it's wise to check the nutrition label for sodium content. Excessive red meat. Red meat is a good source of protein and essential nutrients, but consuming it in excess can lead to higher blood pressure due to its saturated fat content. Consider leaner cuts and limit your red meat intake. Desserts and sweets. High sugar desserts, like cakes, cookies, and pastries, can contribute to weight gain, insulin resistance, and hypertension. While it's okay to indulge occasionally, these should not be a regular part of your diet. It's essential to note that while these foods are considered the worst for high blood pressure, moderation is key. Total elimination may not be necessary, but reducing the intake of these foods can significantly benefit your blood pressure and overall health. In addition to avoiding these detrimental foods, here are some dietary tips to help manage high blood pressure. Increase potassium intake. Potassium-rich foods like bananas, sweet potatoes, and spinach can help balance sodium levels and lower blood pressure. Consume more fruits and vegetables. A diet rich in fruits and vegetables provides essential nutrients, including antioxidants, fiber, and minerals, which support heart health. Choose lean proteins. Opt for lean protein sources like poultry, fish, tofu, and legumes instead of high-saturated fat meats. Healthy fats. Incorporate unsaturated fats from sources like avocados, nuts, and olive oil, which can support cardiovascular health. Watch portion sizes. Controlling portion sizes can help you manage calorie intake and maintain a healthy weight. Reduce stress. Chronic stress can contribute to high blood pressure. Incorporate stress reduction techniques like mindfulness, meditation, or exercise into your routine. Limit alcohol and caffeine. As mentioned earlier, moderate consumption of alcohol and caffeine is advisable. In conclusion, a heart-healthy diet is a crucial component of managing high blood pressure. By avoiding or limiting the 10 worst foods for hypertension and incorporating the recommended dietary tips, you can take significant steps toward better blood pressure control and overall well-being. Always consult with a healthcare professional or registered dietitian for personalized advice on managing high blood pressure through diet.